Hi, my name is Taylor Toch, and I'm doing my mastery checkoff. I have the medications that are given to me and my MAR. I'm going to start off by double, and just so you can see. This is my MAR and the meds given to me. I'm going to start by checking my MAR to the meds. My patient is Marcus Perez. He's a 58-year-old male admitted yesterday for left knee arthroplasty related to osteoarthritis. He reports his pain is now 4 out of 10. He has been experiencing urinary retention since surgery and has new orders to start a foley catheter. It is now 9 a.m. On his MAR, he has heparin 5,000 units sub-Q every 24 hours and morphine 2 milligrams intramuscular every 4 hours as needed for pain. And I'm just double checking I have the right patient, I have the right drugs and dose. But it looks like a nurse has already given his morphine at 7:15 a.m. and since it calls for every 4 hours as needed for pain, I'm not going to give him his morphine right now because he was already given it 2 hours ago. So I'm just going to give him the heparin 5,000 units, which is 1 milliliter. And now I'm going to prepare. Okay. And I'm also giving it the heparin, since it's sub-Q, I'm doing it in the outer aspect of his upper arm. But I'm going to go ahead and prepare the medications. I have washed my hands and I put gloves on. I'm going to start by making a label, and I'm putting heparin 1 ml on it. I have a 3 milliliter syringe, 22 gauge, 1.5 inch needle that I'm going to be using, but I'm going to start by checking the MAR to the medication, which is great. So heparin 5,000 units sub-Q every 24 hours. 5,000 units per ml, so it's going to be 1 ml. Right patient, Marcus Perez. I'm doing it intramuscularly. Sub-Q in his outer aspect of his arm. It is now 9 a.m. It was last given him 8:45 a.m. yesterday. And heparin is a blood thinning medication, and it's supposed to help the body prevent blood clots. And since he just had surgery, we're going to give that to him to prevent blood clots. I'm going to be considerate of things of like abnormal bleeding, of abnormal bruising in the body, and also like maybe some tarry stools, stuff like that, just signs of abnormal bleeding. But also heparin can make my patient like experience alopecia, which is hair loss, and he might get a fever or a rash as well. And the expiration date looks good, so I'm gonna go ahead and prepare my meds. Like I said, I have gloves on, and that's my trash bin over there. So I'm going to start by cleaning the top of my vial from inner to outer for 30 seconds. Okay. Trash over there. I have a blunt tip needle. My computer went to sleep. Okay, sorry, my computer keeps going to sleep, but let's hope that doesn't happen again. Okay. So while I'm allowing that to dry, I'm going to take my syringe and attach it to my blunt tip needle. That. Okay, since I need 1 ml, I'm going to dry that. Okay, air to air. Bubble in there. Okay. There's that. Now I'm going to take blunt tip off. Throw this away in the sharps. And I'm put that there. And I'm going to protect this end because that's the most sterile part. Okay. So that is that. Oh. I'm also going to label, and I'm keeping it at the bottom so I can still see everything. There we go. Okay. Protecting the plunger. Alrighty. Okay. So now that I have done that, I am ready to enter the room. Okay. Alrighty, I have gathered all my supplies. I have double checked my doctor's orders, and I'm going to enter the room. Alrighty. Knock, knock, knock. Closed door for privacy. Hand hygiene. Hi, Mr. Perez. My name is Taylor. I'm an ACC nursing student. I'm going to be giving you your medication today and inserting a foley cath for you. Can you give me your name and date of birth, please? Okay, great. And you don't know your MR number by chance, do you? Okay, I'm just going to double check that. Awesome. And do you have any allergies? Nope. Okay, awesome. My computer. Okay, so no allergies. Awesome. I'm going to raise the bed to a working height and lower the bed rail. Okay, Mr. Perez, I am giving you today your heparin. It is a blood thinning medication. It should help your body not create blood clots. Since you did just have surgery, we're going to go ahead and give that to you. And also, you might experience some hair loss, some alopecia, or maybe a fever or a rash. But again, I'll be back in 30 minutes to check on you. So, yeah, do you have any questions about this at all? Okay, great. I'm also going to, the doctor calls for it to be injected sub-Q. So I'm going to give it to you behind your arm right here on your outer aspect. Do you prefer what arm I use at all? Okay. Awesome. Okay. I'm just going to start by cleaning your arm. Inner to outer for 30 seconds. Trash. Okay, gonna allow that to dry. Trash. Alrighty. Dispose of this in the trash. Alrighty. Okay, you ready? Just gonna Z-track. And at a 90-degree angle, just a little poke. Okay, alrighty. Activating that the safety, and I'm putting it in the sharps container all over there in the trash. I'm gonna apply a Band-Aid. Okay, how was that? That wasn't too bad. Trash. Hand hygiene. Okay, Mr. Perez, now I'm going to give you, insert a foley catheter. Let's remove that. Here we go. And I'm going to make sure that you're in the correct position, dorsal recumbent with your knees bent. Okay. I'm going to go ahead and set up my waist receptacle. Here. Okay, so not touching anything, just the outer aspects of this. I'm going to open this, not touching anything. Touching the outer aspect of this. Down. Now I'm going to get the gloves, the sterile gloves. You can see this. Lay that down. Touching the outer edges of this. Okay. Now touching only the folded cuff. And putting my hand in. Wiggling my fingers in my hand. Now going under this cuff, I'm going to put my hand in like this. Great, just like that. Trash. Okay, so now that I have sterile gloves on, I'm going to push this down in here and just make a better sterile feel. Alrighty, so now I'm going to attach this water thing. It's pre-filled with 10 mL of water. This. And I'm going to take this off. And put it in there, in the trash. Alrighty, I'm going to clean, or not clean, but sterilize Sorry. Going to sleep on you, my computer. I'm going to grasp the penis and hold it at a 90-degree angle. And I'm going to clean from top to bottom. Starting at the top, working downwards. Rub arms, trash. Gonna repeat that 2 more times. From the top all the way to the bottom. Robot arms, trash. And 1 more time. From the top all the way to the bottom. Robot arms, trash. Still holding. I'm going to inject 5 mLs of lube in here. Okay. Alrighty, Mr. Perez. Take a big deep breath for me, holding the catheter 1 inch from the bottom. And I'm going to put it in. Okay. Okay, a few more deep breaths. I'm going to continue that in. I'm going to inject the 10 mLs of water here. You're doing really good. Okay. Alrighty. Okay, feel a little resistance, so we're good. Alright, easy as that. I'm going to lay you back down. I'm going to remove my gloves now. Or I'm going to remove my gloves. Put that in the trash. I'm going to tape this to the side of your leg. Just in case, and I'm going to hang this not on the bed rail, but on the bed. There we go. Okay, Mr. Perez, I am done. I'm going to clean my hands really quick, cover you back up. Are you comfortable right now? Okay, do you have all your possessions? If you have to go to the bathroom, you're all hooked up and ready to go. And are you comfortable? Are you in any pain? Okay, great. Also, here is the call light. I need you to call me if you need anything. I'm just going to put it in your hand. I'm going to lower the bed and raise the bed rails back up. I'm going to see you back in 30 minutes. Check on you. I'm going to wash my hands, foam out, and leave. Close the door for privacy, and now I'm going to document the meds. When I gave the med, I did that right after I did it. I documented the location where I gave it to him and his response and everything, and he was fine. I documented the size of the catheter, his response, and color, clarity, and amount of urine. Yeah.